IPL, intense pulse light, is a treatment that is specifically targeting tone and pigment to the skin. So reds, browns, purples, even a little bit of blues, sun damage, hyperpigmentation, even a little bit of freckling. If you have anything like that, shatters that melanin layer. But we can treat reds, more of like those broken capillaries, red vessels, purple vessels that tend to happen around the cheeks and the nose. It causes vascular retention. And so it kind of essentially shrinks them up, gives that like instant results, and get super customizable to kind of give you more of like an even complexion to the skin. So the wavelengths of the lasers have a chromophore. So the chromophore is like the target, and it's attracted to pigment. So it's looking for those browns, depending on your settings, or reds. And so it's kind of traveling through the skin. It's not breaking the skin barrier or anything. And it's hitting that melanin layer and essentially shattering those cells. And then it kind of triggers our own cell turnover rate process to kind of bring it up to the surface of the skin, so that in a matter of days, it kind of comes up and falls off. Depending on your skin type and your skin reaction, you get a little more of like erythema, sometimes edema with it, just depending on your skin type and what we're treating. And then that hyperpigmentation kind of comes up to the surface of the skin, maybe takes around 3 days to kind of look like coffee grounds and then falls off. IPL is quite similar sensation to laser hair reduction. I always like to compare the two because most people have had laser hair or maybe a little more familiar with it. So it does have that snappy sensation every time you pulse. But with it also has like a bright flashing of the light. It's intense pulse light for a reason. So it's a little bit brighter as well. But usually it's just kind of that little zap that happens and then it goes away. I always kind of put little cotton rounds and titanium shields on the eyes just to kind of like cushion the flash, because it is so bright that you'll even see the flash kind of through that. But they're 100% protected with that. Melasma is a little tricky. You typically want to stay away from IPL or even like heat-based treatments. You want to be a little cautious just because it can kind of hold on to that heat from the laser and possibly cause it to get a little bit darker. Definitely no sun exposure for around 2 weeks before or after. Luckily, we're in the Pacific Northwest, so nothing gets too sunny as long as you're wearing your SPF and, not have any long river days or anything. Adverse reactions can happen if you do have that sun exposure, even intense heat exposure afterwards, just because you have that energy, you have that heat built up into the skin. So if you expel it in any way, it could cause your hyperpigmentation to get worse, which is not the goal, and possibly risk of burn or blister. But luckily, it's pretty easy to avoid as long as you're following protocol.